Picture this. You're at the playground, you hear kids laughing and yelling, and then that sound, that sudden, awful thud. You look over and a kid is getting up, crying, hand clamped right over their mouth. It's a moment that just sends a jolt of panic through any parent or caregiver. Your first thought is, are they okay? And your second is almost always, oh no, what about their teeth? Now, you might think this is some kind of rare freak accident, but it's really, really not. Look at this number, 25%. A full quarter of all kids will injure a permanent tooth before they're even adults. That means for every 4 kids you see running around, one of them is going to face this exact situation. It's way more common than we think. And in that moment, panic is your absolute worst enemy. But you know what your best friend is? A plan. The whole point of this explainer is to give you that plan, a super clear, simple guide so you can turn that feeling of fear into calm, confident action. So let's build that plan step by step. Okay, so the very first thing you need to do is figure out what you're dealing with. And don't worry, you don't need a medical degree for this. We're just going to do a quick and simple visual check. Really, it all breaks down into 3 basic questions. First up, get a good look at the tooth itself. Do you see a fracture? Now, this could be anything from a tiny little hairline crack in that shiny outer layer, the enamel, all the way to a big, obvious piece of the tooth that has just snapped right off. The next question you're asking is, has the tooth been moved around? Is it kind of wobbly if you touch it? Or maybe it's been visibly pushed back or forward or even sideways in its socket. This means the stuff holding it in place has been damaged. And finally, we have the most urgent scenario of all. Is there just an empty, bloody socket where a tooth should be? This is what we call an avulsion. And when this happens, a clock starts ticking immediately. This is the one situation where what you do next is absolutely critical. So let's zero in on that most urgent case, because what you do in the next few minutes can literally make all the difference. This is where your quick action can decide whether that tooth is saved or lost for good. Now, before we go one step further, this is the single most important rule you need to burn into your brain. If the tooth that got knocked out is a baby tooth, do not, I repeat, do not try to put it back in. You could actually do some serious damage to the permanent tooth that's going in the gum right underneath it. But if it's a permanent tooth, well, that's a whole different story. Your mission is to save it. So why all the urgency? Well, it's all about biology. A tooth's root is covered in these living cells, and they're essential for it to reattach. Think of them as the tooth's life support system. The second they dry out, they start to die, and if they die, the tooth can't properly connect back to the bone, even if you stick it back in the socket. Acting within this first half hour, that gives you the absolute best shot at keeping those cells alive and saving the tooth. Okay, here it is, your step-by-step game plan. Let's just take a breath. First, stay calm and find the tooth. Next, pick it up by the crown. That's the white shiny part you chew with. It is so important that you do not touch the root. If it's dirty, just gently rinse it for a few seconds with milk or a saline solution. No soap, and please no scrubbing. Now, if you can, gently push the tooth right back into the socket it came from. Have the child bite down on a clean cloth or some gauze to hold it in place. If you just can't get it back in, place it in a small container of milk. Milk is perfect because its chemistry is really friendly to those root cells we just talked about. Your own saliva is a decent plan B. The goal is simple, just keep it moist. And last but not least, get to a dentist immediately. So you've handled the immediate crisis. Great job. But what's the very next step? See, not every dental injury means you have to race to the emergency room. Let's break down when it's okay to just call the dentist for an appointment and when you need to go, like, right now. Think of this as your quick little cheat sheet. For a chipped or broken tooth, the urgency is pretty low. Just call your dentist and make an appointment. For a loose or displaced tooth, okay, the urgency is medium. You really should try to see a dentist the same day if you can. But for a knocked out permanent tooth, the urgency is high. That is a true dental emergency. You drop everything and you get to a dentist. And for a knocked out baby tooth, remember, you don't put it back in, but you should still call the dentist for an appointment just to check for any other damage. It's really easy to just focus on the immediate visible problem, right? But the title of this explainer is more than a smile at stake for a good reason. How you handle a dental injury in that first hour can have consequences that last for years. If it's not managed well, it can lead to infection, nerve damage, or even problems with the jawbone itself. And that could mean way more extensive and expensive dental work later on. Your quick action isn't just about saving one tooth today. It's about protecting a whole lifetime of healthy smiles. So let's just boil this all down. What are the three most important things to take away? First, stay calm. Your calm energy is going to help the child more than anything else. Second, act fast. Especially for a knocked out permanent tooth, remember that 30-minute window. And third, know the plan. Know how to spot the injury, how to handle the tooth, and when you need to get professional help.
You might think that an injury to a baby tooth is, no big deal. It's going to fall out anyway, right? But this quote here shows you the hidden stakes. Trauma to a baby tooth can actually disrupt the permanent tooth that's developing right underneath it. This could cause the adult tooth to come in discolored or crooked, or in some cases, it might even stop it from coming in at all. It's the perfect example of why a professional checkup is so important for every dental injury, no matter how small it might seem.
That moment of panic on the playground, it doesn't have to end in confusion anymore. Just by knowing how to check out the situation, understanding that critical difference between baby and permanent teeth, and having a clear first aid plan, you've basically transformed yourself from a bystander into a first responder. You have the knowledge, you have the plan, and now you have the power to turn a moment of total panic into the story of a saved smile.